because we have so much passion about the field. We own so many images and so many videos and so much pathology. It just honestly seemed like the right thing to do is to share it with everybody else.
Hi, my name is Molly Batten with ESP Ultrasound, and welcome to our Meet the Authors segment, where we have the pleasure of introducing the brilliant minds behind the Art of Vascular Ultrasound. We are thrilled to have their insights and experience shared in this must-have addition to ESP's offerings, as well as your bookshelf. I'll have Jean and Bill introduce themselves, but together they have crafted the Art of Vascular Ultrasound to be an indispensable resource for anyone looking to master this challenging and rewarding field. Their combined expertise and passion for teaching shine through in every chapter, making this book not just a guide, but a companion in your journey to becoming a skilled vascular sonographer. So let's go ahead and get started. Let's meet Jean and Bill.
Well, my name's Bill Schroeder, and I guess, you might be a little reluctant to ask me a little bit about my history of my ultrasound journey because I'm kind of a history buff and I tend to go on. I will just say that, I've been doing this for a long time, but I was really one of those kind of lucky, rare people who never really had to go to work because I always loved scanning patients as well as talking to colleagues about vascular ultrasound. Interestingly enough, I began my career in a hospital doing what in those days was called cardiopulmonary, which kind of was respiratory therapy as well as EKGs and stress tests. And it was really kind of a great introduction into healthcare and the hospital scene, because I got to go everywhere, all the specialty floors, the emergency department, critical care. So I got to see a little bit of everything. But then we got this new instrument that used ultrasound to obtain data from the heart to kind of assess the pump and valve function. Basically, I kind of fell in love. I started doing some contract work outside the hospital, and I got a call from a vascular surgeon who was looking for a sonographer to do some vascular. Sure. So he was pretty into the ultrasound part. And I'll just mention, he did his first carotid endarterectomy based solely on ultrasound in 1984. Maybe the first time that was ever done in the country. And he was always a great teacher and really into it. But what was really fascinating about that is nearly every day I would find something on a patient that I would not, I wasn't sure what it meant. So I would ask him. And often he was not sure either. And there wasn't a whole lot of books or resources available in vascular ultrasound to be able to say, oh, this is what it is. So we asked more questions. We tried to figure it out. We went to meetings to present what we found. We published some papers. My first presentation was in front of the AIUM meeting, probably over 800 attendees, nearly all physicians. Talk about nervous. Well, jump ahead a few years. I was introduced to Jeannie by some mutual friends at an SVU meeting, and it was so cool to meet someone as crazy. Well, can I say that? As myself about this profession. At the time, I even mentioned to her, I had this premonition that we had a destiny. So several years later, I got a call and she goes, oh, I'm moving to this area close to where you are. And shortly after that, we started working together. And I think I can just say we both simply love vascular ultrasound. I hope she's learned half as much from me as I've learned from her. Her perspective is so valuable to my admittedly sometimes, manic thoughts. So we've come a long way, but the fantastic thing, there's still so much to learn, and that's why it's such a fantastic field.
My name is Jeannie, and I am a vascular sonographer and a big vascular nerd. I started my medical background was a medic in the Army. And when I came back to come to college or go to college, I was in school for nursing and working part-time, just so happened, in a vascular surgical office. And there was a physician by the name of Dr. Cranley who they assigned me to. And when I was working with him, he wanted to find out what my background was, and he thought I was a very curious young person because I was young back then. And he said, "You don't want to be in school to be a nurse. You want to be in school to be a vascular technologist." And I said, "Well, what the heck is that?" And so he went over to his bookshelf and pulled out stacks of books, handed them to me, and said, "This is what it is. So take a look at this. Ultrasound is going to change the future of medicine. And take a look at some of these books and then get back to me." And I said, "Well, what would I do? How would I do this with, school?" He said, "Well, we change some of your courses, some of your curriculum. I want you to take some mathematics, some physics, and all the other healthcare stuff is fine, and I'll sponsor you if you choose to do this." And this was back in 1990. And so I thought about it for about 3 weeks, and I assumed that all physicians went over to their bookshelf and grabbed a bunch of books that they authored and handed them to people because I knew nothing else. It turns out that Dr. Cranley, John Cranley, had the first vascular laboratory in the United States from an affiliation with Massachusetts General Hospital. He was a fellow from the Linton Brothers, very old procedure that used to be performed, no longer performed, the Linton procedure. At that time, they had a laboratory, but they didn't have ultrasound. They had all types of plethysmography and things like that that they used to measure blood flow in different ways. Well, it turns out that Dr. Cranley invented what's called the PRG. Before we had ultrasound, we used to use respiratory waves to determine whether there was occlusion or not in the venous system. And so he was the developer of that. So he was a very scientific mind, vascular surgeon. He was friends with Eugene Strandness, who was all the way across the country. And that's really where my background started, is him saying, "You want to do this." And he also told me this, which was kind of, I guess, clairvoyant. He said, "If you do this, you're young, the field is young, you could end up being a leader. You could end up being somebody that will be a natural teacher to the field and carry the history as it continues to develop."
Can I just add to that too? I had the opportunity to meet him, and we spent a little bit of time with him. A really, really special individual.
Before he passed away, that's how Bill was able to meet him. So I worked, my first decade was with Cranley Surgical Associates, this vascular surgical group in Cincinnati, Ohio. And then my second decade, third decade, and going into fourth was Bill and I started a vascular laboratory in Florida. And before he passed away, I think it was about a year or so before he passed away, he came to our laboratory. He said he had to see it, he had to come. And so he came and he took us out to lunch and he met our medical director, and he basically gave us our blessing. And he was super proud that, not only had I, taken him up on the offer to become a vascular technologist, but that I had found a very strong business partner, like-minded scientist, curious vascular ultrasound mind, joined together and formed an independent diagnostic testing facility for which then we practiced. So,
And we have a picture of him
yeah, we do.
standing outside the office in front of the sign
Yep.
outside the office door. So
A very
uh,
proud moment. Very
very
proud
proud
moment.
moment. Just to add too, certainly not as well known as like Gene Strandness, who arguably is the father of the profession. But at the same time, the origins really came from John Cranley. I might just say, or maybe reiterate the point that what really fascinated me is here I'm scanning a patient, trying to make clinical decisions about this patient or providing the information to make the clinical decisions. And I'm going like, what does this mean? Which was, kind of hard to wrap my mind around. But, it turns out that it's really the gift that ultrasound has to give back to the person because you never know it all. It's really kind of an endless wellspring of knowledge. It's, always endlessly intriguing. And, that's just kind of what kept me coming back. And even after, almost 40 years of scanning patients, we would still routinely go, wonder what that means. Hey, I've called the other, what do you think about this? Or I had this patient, what does that mean? I mean, it's a little scary for the patient, but at the same time, it's endlessly fascinating. I might I mean, certainly, I think we have included a good many kind of, not only basic and intermediate, but also some fairly complicated cases in images and then tried to explain them.
In both arterial and I think probably especially venous hemodynamics, is we have tried to explain to the best of our understanding of how the system works for what we know today. So I'm leaving that open because in our years of how we assumed things worked, for example, the physics behind how a valve closes and what is actually happening there, or the way that the blood is actually flowing, there's been changes and updates while we've been practicing. And so I would say we would probably be pretty narrow-minded to think that we actually really, really know how it actually flows in
And
all cases.
And we always tend to try and make the point too, is that, well, I have my transducer over this, 3-inch segment, of the vein, or I'm scanning down these major veins, and then I'm trying to extrapolate, well, what is this very, very limited information about just you know, literally a small part of the system? What does that mean to the patient's hemodynamics? And that's what we don't know, and that's why it's fascinating. I'd like to get in and kind of float around with the blood cells.
We can make that happen. Gotta get on the magic school bus
Yeah.
where they shrink down.
Every day.
All right.
Every day scanning.
I think that if someone was they were on the fence about, is this the profession that I want to get into and study? I would say first and foremost that they need to like people. And that is very important when it comes to the patient care. If they like people and they find themselves or they classify themselves as a helper or a caretaker, that's a really, really good sign. But then here comes extra beauty. You have to be technical. So you're kind of science oriented as well. And then you have to like magic because it literally is magic to take a transducer, put some gel on the skin, and you get the window to see inside a human body and see. And in our case, we're looking at blood flow all the time, it actually flowing and moving, and it is fascinating.
that's easy because it's going to continue to kind of fascinate, inspire you to learn more, and really to continue on that journey to do the best you can for your patient. And ultrasound is really great because you get this 30 to 45 minutes of, relatively close contact with the patient. And so it really provides for a fairly unique relationship in order to really make the difference. I discovered that I often got as much from the patient as I hoped they got from me. And of course, getting it right, in fact, could save that patient's life. So, it's an important and rewarding job.
I would say probably contrast, the contrast enhancement stuff, because I think by making the contrast and slowing the blood, being able to see it actually move, I think we're going to learn a lot more about the incredible hemodynamics that's actually going on.
No, I would
And
agree with that. That, one of the issues that I see is that there's really too many to even list. The technological advancements have really been happening so fast the last few years. I just can't say that there's simply one. There are really many. One of the exciting things for me is the 3D transducers, and the exceptional level of beam control that's possible is pretty exciting. And I think that while that's still kind of on the high end, that technology will trickle pretty rapidly into many of the labs. One of the things that I'm kind of hoping for is really the holy grail of ultrasound for nearly as long as I've been doing it. And that is, the ability to evaluate a plaque, particularly in the carotid circulation, and determine what characteristics make this plaque safe to watch, very unlikely to result in, an embolic phenomena, or is this a dangerous plaque and this patient would benefit from intervention? We're not there yet, but we're kind of right on the cusp. We have a few small sections on that as to, where the contrast is particularly applicable. Just recently over the last couple of years, the contrast enhanced ultrasound has been shown to probably be more accurate than CT or any other technology to detect the presence of endoleak following endovascular aneurysm repair. And as Jeannie said too, is that trickles into the evaluation of almost like microcirculation, that has the potential to really change things.
Which that microcirculation, and we are already beginning to understand it a little bit more, but really how the lymphatic system and the venous system and the fascia all work together. It's not just about the veins. I know that, but I can't tell you how intricate it is. And my gut says, because just take an example of a person with a huge varicosities and no edema, and then take someone else with some varicosities, tons of edema, and there's a disparity regarding that. And so much so that the lymphatic society and the venous society joined together, almost as just an example of how intricate those systems are. And I think that with contrast and like really getting down into the nitty-gritty of how it actually works, and is it a fact more on the lymphatic side and the lack of fascial support that maybe contribute to some of the dilatation of the veins and or the spillage of the fluid. So
it'll be a whole nother chapter
yeah.
next time. How the venous and the lymphatic system work together.
Jeannie does have the reputation among her colleagues as being kind of the vein queen. So That's where her head goes. She dragged me kicking and screaming into the vein world, but it kind of became my favorite. So
Well, and that I think is the compliment of us is that Bill was more known for his arterial hemodynamics in the forefront, some of the first published articles on it and everything. And then and my vein background with Dr. Cranley. And so the merger of the two of us then became the big challenge for him to challenge me about what I didn't know about arterial hemodynamics. And then neither of us really fully understood the venous hemodynamics, but I knew the anatomy in a very detailed way that he had never been challenged at that point. And so I would say that's the other thing that's so cool about vascular technology is because of the diversity and background, um, each vascular lab is a combination of those technologists, those sonographers that work together. And then you can push each other into places that you wouldn't go all by yourself. The Art of Vascular Ultrasound is unique because it is, in essence, the open playbook to the vascular laboratory that we started and ran for many decades. And so in it is a culmination of not just, what you need to know, but how to apply what you've learned and what you know, all our tips, all our protocols, and then verifying and how you go about verifying that you're actually accurate, as well as interpretation criteria, and then a real case studies for each chapter of the pathology that was real to us. And so we tried to not necessarily present the most unique pathology that we saw, but more the generalized something that you would really want to focus on and how you would interpret a report, and then how to bill. So it's the mixture of practicality and science altogether.
I would, strongly agree with that. I mean, it's based largely on our experience within the field and kind of our desire to share the decades of that experience, that we've accumulated over those years. So we go through the basic knowledge, the application. We also talk about the limitations and especially, the questions that remain to be answered about each of those applications. Um, so it is based on a large amount of research into the literature, but that's, strongly coupled, I think, with our personal experience using the techniques and the perspectives that we describe so that the advice that we relay in this, we hope is not only solid, but kind of personal, tested, and we hope very practical. While Jeannie's thinking, I'd say I would strongly argue that there's not one thing. I don't want them to just take one thing away from that. Really, the idea was to offer kind of a complete treatise on not only how to do the exam, how to interpret the data, what and how that impacts kind of the clinical course of the patient. If I have to say, okay, you're going to say, oh, give me one skill, I'd say maybe how to approach the art of obtaining that beautiful image that answers the clinical question for the patient.
I would say I don't think there's just one thing, but one thing that we did work very hard to do was to list each and every blood vessel and how, based on our years of experience, and the things that we had tried and didn't work. So we only put in there the nuggets of put the transducer here, angle it this way, ease up on your pressure, do this, do that. And so all our tips and tricks are there blood vessel by blood vessel. Well, what we tried to do was just organize it in a way that it could be a one resource solution for a vascular laboratory and or a collegiate program. So we purposely set it up into the four parts, which is know, the things that you must know. And we didn't go down an anatomy path of something that you're actually not going to be looking at those vessels unless we thought somehow that those vessels would affect flow. And so then the knowledge needed to be there. And then we work into I, which is the step by step, each blood vessel, all the tips, all the tricks of how we best image them. And then we have our protocols in there, the ones that we used in our laboratories every day for decades. And those protocols can actually serve multiple points. One, the student can check themselves to make sure they actually know how to perform an entire exam. Two, an instructor could check the student to, use it as a, clinical verification. And then three, because we were always in the business of hiring technologists, you could use that protocol as, does the person you're trying to hire know how to do the steps to finish an exam? And then the verify, which is the interpretation, and also verifying, like, how do you know that what you said actually was there? So some of the of that applicability. And then the overview or the review section includes at the end of it a case study from our lab, a real how the report was written, the information that was most applicable, and then what the end result was, how it was interpreted. And then we, followed it up with questions that we think are applicable so that you can test your knowledge of your understanding of everything we just went over. And so we really tried to balance, and we also include billing, even though not every vascular laboratory needs to know all the codes and the procedures, but it's really our vascular laboratory between a front and a back matter. That's what it is. We're hoping that if a program decides to adopt our textbook, we are putting together. They'll have a PowerPoint that goes hand in hand with the textbook, as well as case studies, additional questions that they can use. And we hope that each chapter. So when we were developing it, the question was asked to us, does this book build upon itself? And in some ways it does, because there's the basic of physics, the basis of duplex, and then you start getting into the different types of tests. But what we wanted to happen was that each chapter could stand alone as this is how you do this test. This is the important anatomy. These are the blood vessels, how you look at them. This is how you make sure that you are correct. And then this is the review and the absolute, you got to know this information to do this test. And so each section does that, rather than you have to go back to chapter 3 to find the anatomy to be applicable to chapter 5, which is about the aorta and the iliac. We teach you that same anatomy right there. So each chapter stands alone, as well as builds in complexity as you move through the book. I think so. I think what is valuable is dependent upon which laboratory you work. You could be in a vascular laboratory that does mostly veins and dabbles in arterial. But then here comes the patient on a Monday morning that needs not just a carotid, but a TCD. And you're not as familiar with that. Well, our hope is with having this textbook on your shelf, you can pull it out, remind yourself back to when you were studying to pass your boards, what's applicable for the test, how do you do it, how do you look for the blood vessels, how do you find the pathology, how do you interpret it, and same for the physician. All that information is in there in a very concise manner of these are the interpretation criteria that we used and adopted in our vascular lab over all the years.
I think the other thing I'll just elaborate on that Jeannie mentioned, not only is it all the way through there, but while it's largely based on kind of practical personal experience that we did, there was also a significant amount of research. For example, not only were we just laying out the anatomy, which is, pretty common, available everywhere, but then we touch, well, here's some variations that you may encounter, so be aware of that. Here's how you do the exam. Well, that's kind of based on personal experience. Here's the interpretive parameters. Well, there was this paper that said this and this paper that said this, and this is what we did, how to deal with the nuance in variations. So in addition to our personal experience, I don't think we slighted the field or the literature about what has been thoroughly validated, albeit little variations in that too, from one group to another group. But for the most part, a pretty good consensus. So kind of how to deal with those nuanced variations.
We want to kind of take the I guess the mystery out of some of the parts that are intimidating for people, so that they can actually feel like they can do any test that's in that vascular realm, that they at least have these little nuggets from this book and they're not going to be intimidated.
Absolutely no, all of them, and there's so many more. I got another 10,000 on my computer, so not just the one. We hope we used good illustrative case studies there, but I can't say that there's one. How about you, Jeannie? Something
Well,
stick out to you?
there's two that stick out that I knew that we had to include. Both ended up changing the clinical course of the patient. Both were original misdiagnoses that we got. One, someone who had simply had claudication and iliac stenosis, but went off and had back surgery and all kinds of issues because they just didn't do ABIs or segmentals and then exercise them to see that drop in pressure. And then on one of our venous cases, there is someone was scheduled to have a aneurysm repaired of the deep system, and it was not a deep vein aneurysm. It was a superficial vein aneurysm, but it had a unique anatomical setup. And so we tried to lay out the importance of knowing the nuances of the anatomy so that you don't get a big surprise in the and the person goes on to start having a surgery that is unnecessary.
And that was like scheduled like the week before or the week
Yes.
after we saw her too,
Yes.
like imminent.
Yeah.
I would just say savor the questions that you encounter. I already kind of talked about this, but that's really what makes the profession the best. You're never going to know it all. It's not a dilemma, but it's really a gift. One of my heroes, physicist Richard Feynman, I would rather have questions that cannot be answered than answers that cannot be questioned.
So if I was going to talk to my much younger self and I found out that this much younger version of myself was choosing vascular technology, I would say kudos to you. You just picked the best career path that you could absolutely ever pick. You will never stop learning. You can have an impact on your patient, and then of course, by taking care of your patient, that's somebody's mom, somebody's grandma, somebody's daughter. Now you're helping that whole family, and it's unlimited, and it's unlimited for the challenges that you'll face. You're never gonna look back. What a great job picking this as your profession.
Our hope that the profession will benefit from the information we try and share. That's the goal.
So many experts that have contributed to our field, and I think we tried to really walk that delicate, balance of the honoring those people that have published before us, and referencing them accurately, and making sure that our understanding of how we were applying their research, how we ended up applying it to our lab, and then how our lab ends up benefiting from that information, because there's so many people that have dedicated their entire lives to this field, and we hope that we got that right for sure.
We wouldn't be the same, undoubtedly we would not nearly be the same without our, sonographer and physician colleagues that we've worked with and shared with over the years. So we thank them all. They know who they are. I hope. Maybe we need to make a list.
Thank you so much, Jeannie and Bill, for sharing your experiences and your stories. We are so excited about the Art of Vascular Ultrasound. If you're interested in learning more, come visit us at esp-inc.com/TAOVUS. And if you're curious what that graphic is on the cover, stay around for the last few seconds.
Yep. So here's the cover of the book. And it's super cool because this is actually a sound wave generated by a guitar strings. And so we just thought it's so beautiful, and it came like this. So it's blue, but then integrated into the red. And so just the art of vascular ultrasound.